Hello and welcome to the Multicultural Mindset. Listen, I get people asking me regularly, how do they introduce content around race, culture, and ethnicity in the counseling session? Well, there is one person who is the expert, the researcher on how to broach these sensitive topics. And I am so happy to say that she is my guest today. In just a minute, you'll be meeting Dr. Norma Day-Vines.
Welcome to the Multicultural Mindset. Your host is Dr. LaVerne Hanes Collins, a licensed professional counselor, award-winning trainer, and keynote speaker. Dr. Collins is the author of Overlooked, Counselor Insights for the Unspoken Issues in Black American Life. Now, here's Dr. Collins.
Yes, welcome back. I'm LaVerne Hanes Collins, your host, and my guest today is Dr. Norma Day-Vines. She is a professor at the School of Education at Johns Hopkins University. She maintains a faculty appointment there as Professor of Counseling and Educational Studies. But before going to Johns Hopkins University, she held tenured faculty positions at the College of William and Mary and also at Virginia Tech. Dr. Day-Vines' research agenda is such an important one because she examines the critical concept of multiculturalism as an indispensable tool in the delivery of culturally competent counseling and educational services for both members of our practice community, for students from marginalized groups, and for us as providers. Dr. Day-Vines is essentially the expert, the guru, the go-to person on this topic of broaching, and she is just this year releasing her new book, even after 30 years of research. So you know this book is going to be amazing, right? Because there's so much time and research that's gone into it. Please help me welcome Dr. Norma Day-Vines. Dr. Day-Vines, thank you for being here. I am so excited. I have followed you, as you know. I have watched your work. I have, I've read. I've told everybody else to read your work. So, thank you for your contributions to our profession and for being here with me today. I'm glad to have you.
Well, I'm definitely glad to be here. Thank you very much for the invitation.
Oh, my pleasure. I am excited about your book because, as I said, you've been researching this topic. I want you to just please just share with us. Let's start with broaching. I'll let you define it and talk about its significance,
Mhm.
and then tell us how you were inspired to even go down this path in your career.
Certainly, certainly. So, one of the things that I sort of think about when I think about this topic is that pretty much counselors and mental health providers can talk about divorce, they can talk about depression, anxiety, grief and loss, career development, failed relationships, but they often have a hard time having this discussion in the context of race, ethnicity, and culture. And we know that demographic shifts in the population have occurred. So we have an increasing number of people from minoritized groups who are now coming to counseling. But when counselors can't talk about how race, ethnicity, and culture shape clients' presenting concerns, it's a turnoff to many clients. They don't return. We know that 30% of all counseling sessions end prematurely, but 50% of counseling sessions with ethnic minority clients end prematurely. And part of that is because many providers have not mastered a way to have these discussions in meaningful and substantive ways. And so clients then decide, I'm not coming back because they don't feel heard, they don't feel understood. And then when we think historically about mistrust, cultural miscommunication or mistrust, that tends to be a challenge. So when I think about cultural mistrust and cultural miscommunication, that's how it's often talked about in the literature, but I think it's really deeper than that. When we think about the historical significance of all of the oppression that particularly my emphasis is often on African Americans, that African Americans and other minoritized groups experience. Um, there is not a level of trust. There is a fair amount of mistrust, and many would argue distrust. When we think about trust, we think about having confidence in our providers. When we think about mistrust, we have this sense that, maybe there's reason to, to not have faith that things are going to work out well. But when we think about cultural distrust, there's evidence. And when we think historically about psychiatry, when we think about health, mental health, healthcare disparities, mental health care disparities. Many people of color and people from minoritized groups have, legitimate reasons for not trusting that counseling will work out. And so my effort was to begin to think about how can we help counselors have these discussions in a meaningful way. My first year of teaching, I was at a small liberal arts college in Virginia, and I was teaching a diversity class, but I was also teaching practicum and internship. And I noticed that students could have meaningful conversations with clients, but they were never able to center issues of race and representation in the sessions. And so, what I started doing was creating instructional activities that would help the students sort of talk about race, ethnicity, and culture, center it, feature it. And that I felt that helped to some extent. This work around broaching never intended to become a research agenda. It was just an instructional strategy that, took on a life of its own. And so I was working in the counselor education program, and I noticed that the faculty members in the clinic started teaching my work, and I said, "Oh, I better start writing about it before, I lose the opportunity to say that, sort of this is my work." So that was the impetus for it. One other thing I will say, an example I like to use in terms of talking about broaching, when I define broaching, talk about broaching as a way to have a conversation around a difficult topic. And years ago, again, my first faculty appointment, our master's students were counseling undergraduate students. And at this institution, there were very few students of color at the time. And so I had a 25-year-old white female student who was counseling a 19-year-old African American undergraduate. And their sessions were going round and round. I don't know if you've ever had a session that doesn't go anywhere, but their sessions were going round and round. And each week, the student would come to supervision and she would not talk about issues related to race, ethnicity, and culture. And I said, particularly as a white student, this is something that you really need to be able to do. And so by the third or fourth session, I said, if you do not ask this student what it means to be one of very few African Americans on this campus, you will not pass my class. So, students are addicted to A's. And so the next session, she did come and she presented a tape that demonstrated her inquiring about the student's experience as one of very few African Americans on campus. And as you might imagine, the floodgates came open. The student went from talking about absolutely nothing, like what I call chit chat. Hello, how are you? How are classes? It was like fine to talking in meaningful and substantive ways about her experience. She was the first in her family to go to college. She was from an urban community. She felt a sense of isolation and alienation on campus. She didn't get invited to study groups. She was thinking about dropping out or withdrawing from campus. So when I saw that, I was like, yes, this is why we have to have these conversations, because oftentimes clients will withhold information unless we give them permission to have these conversations. I always say that the counselor wields the balance of power in the counseling relationship. And unless we extend the invitation, clients may feel like it's not okay for them to have this conversation. The next semester, I had the same student in class, and she said one day, and I had her for internship, and she said, "Dr. Day-Vines, may I say something to the class?" And I said, "Sure." And she said, "Last semester, I had Dr. Day-Vines for practicum, and she told me I needed to broach, and I didn't think it was necessary, and I didn't. And then she threatened me, and so I did. And she even went to therapists in town to see if it was really necessary. That's a whole nother discussion to see if
To
it was
see if what you
if
said
what
was
was
true.
yes,
Need a
yes,
second opinion.
yes, a second opinion. So she said, what I thought was really profound. She said, I didn't think it was necessary, but after I asked her what it was like to be one of very few African American students on this campus, and she responded, I realized in that moment that I was the one that was uncomfortable having this conversation. It wasn't the client. The client was willing. She was ready. She was poised to have this conversation. It was me that was on the fence. And so that's sort of my description of broaching and why it is so important. And it's important for those identities that are visible, but it's also important for those invisible identities that, sort of people have.
Yes, yes. Thank you for doing what you've done because you've certainly influenced me. That
Hmm.
is one of the pillars of the work that I do. I'm teaching people you have to, as a provider, it's up to you to be the one to bring this content from the background to the foreground.
Hmm.
And I emphasize the fact that when you're working with people who have been otherized and minoritized and racialized and have come from any degree of survival oriented community history,
Hmm.
it's up to the person who has the authority in the moment
Hmm.
to make it open, to open the
Hmm.
door.
Hmm. Hmm.
And just thank you. Thank
Hmm.
you for all the ways that you have poured into your work to make our profession better
Hmm.
for my people, our people, all people.
Yeah. Yes.
Yeah.
Yes.
Tell us about the book.
So, yes, the book is titled Broaching Race, Ethnicity, and Culture in the Counseling Process: Strategies for Facilitating Meaningful Dialogue with Clients. And basically,
Strategies. See,
strategies.
that's
Hmm.
important. Not
Hmm.
just this is important. You're giving
Yeah.
strategies in this book.
That
Yes, please
that was the
continue.
whole premise of the book. So there are three components, really four components of the model. The first one is the continuum of broaching behavior, and basically that talks about counselors' openness to having discussions with clients. So are counselors of completely avoidant, where topics will come up and then they pivot away? Are they, sort of on the fence, bringing up once, like one and done? Do they broach and broach ineffectively? Or do they
Mhm.
broach it in a meaningful and substantive manner that allows clients to talk about, important aspects, racial, ethnic, cultural aspects of their lives? And then at the highest end of the continuum, are they invested in social justice, systemic change, advocacy, or, advocacy action? So I first lay
Mhm.
out, first lay out a rationale for broaching, but then I talk about the continuum and ask readers to identify themselves on the continuum. And I have a little survey that people can take and sort of look at their predominant mode of functioning. After I developed the continuum, the second part of the model that I developed was the multidimensional model of broaching behavior. Because I would go to presentations and people would think that broaching meant to say, I'm black, you're white, how do you feel about working with me?
Mhm.
And one of the things I say is that I've been black all my life. And I've encountered a fair amount of racism and discrimination. That's the other thing people thought, that broaching was only about racism and discrimination. I've
Mhm.
encountered a fair amount of racism and discrimination across my lifespan, but racism and discrimination aren't the only factors that affect my life. So I'm more than the sum total of the encounters I've had with racism and discrimination. So I wanted to talk about contexts in which counselors can broach. So I, and along with colleagues, have developed the multidimensional model, and we talk about four dimensions of the model. The intra-counseling dimensions, it talks about the counsel-client dimension. So it's not just that we're broaching, but as a counselor, I need to get from the client, how is this working for you?
Mhm.
How are our similarities and differences impacting the counseling relationship? If
Mhm.
I'm working
Do a
with
temperature check, so to
do it.
speak.
Yes, absolutely. So that I get a sense of where the client is. And when I go into classes, I'll often do demonstrations with students. And I had a young African American female student one time that I was going through a demonstration, and I said, we're both African origin women because those are some of our shared identities, but we are from different age cohorts. And I wonder what it's like for you to work with somebody from a different age cohort. And she was like, well, yeah. because you remind me of one of those old black church women. And that I got tickled.
Was real, but it
Yeah,
was
it was
real.
real and it was honest and it was authentic. But that
Uh-huh.
is the cue, not to get defensive,
Right.
but to then begin to think about what experiences have you had that number one make you think of me as an old black church woman, and maybe are there negative religious experiences that you have? Have you been turned off by it? What is it that is shaping our interactions, and how do we need to frame this interaction so that counseling will be meaningful for you? In that
Yes.
same dimension, we talk about
So
it's important
good.
to invite the client to have conversations around race, ethnicity, and culture, and let them know it is permissible. So that's one dimension. Another dimension is the intra-individual dimensions, and that's where I think about intersectionality. So I am not just, one thing. We are very complex beings. So we are our race, our gender, our sexual orientation, our national origin, our age, like
Mhm.
all of these domains come together. And so we're not just single axis creatures.
Exactly.
We have multiple intersecting identities, and for many people, those multiple identities are also multiple sources of oppression. And so
Yes.
I draw from Kimberly Crenshaw's work on intersectionality there. And
Hmm.
then the third dimension is intra-racial, ethnic, and cultural dimensions, because oftentimes people get a lot of support and sustenance from members of their own community. But they also get stress, they also experience stress and strain from their community.
Yeah.
Maybe when in class, one of the things I often see are students who are the first in their families to go to college. And so there may be tension between the family members that are educated, the family members that are not. There often are tensions with people who are striving to enter the middle class. And what does that look? Sometimes they feel like a fish out of water. I think
Mhm.
about colorism in our communities, and not just the Black communities, but many communities, sort of color. Sexual orientation is another, sort of identity domain that may have different meanings in different communities and different families. So, what does that mean? And we know that minoritized individuals who are also who are both sexual minorities and racial minorities may feel marginalized in both communities. As they're put on the margins in terms of their race in uh, um,
Ability
homosexual community.
status or
Mhm.
yeah,
Mhm.
so
And
many
they're put
so many
on the
things.
margins in the Black community or their minoritized communities because of their sexual orientation. So how do we address those multiple sources of oppression that may occur within community?
Within.
And
Yes.
also the sources of strength and support that occur within. And sometimes
Yes.
the source of strength and the source of stress may occur simultaneously. So being open to talking about that. And then finally, we get to racism and discrimination and how that impacts. So, sort of identify these four different domains that allow us to think about how we broach and what we broach. And
Well,
that
I love
broaching.
that. Yeah, I mean, catch up. There's so many different facets
Mhm.
that, and as in my book, overlooked that we don't
Yes.
talk about.
Hmm.
And what you're doing is, overlooked says we don't talk about this. Your book
Hmm.
says, here's how we talk about it.
Yeah.
Here's how we
And you
introduce
and
it.
you are cited several times in my book.
Oh, God bless you. Thank you. And you in mine. Yeah.
And
This
then
is
I'll tell
so
you, if
rich.
I can
Go
tell you about
ahead.
the third part. The
Okay.
third part is strategies. So how do we broach? And one of the
Okay.
things I argue is that broaching is not an event, it's a process. So we start broaching even before we've even seen a client. We broach in terms of, where's my office located? Am I on a bus line? Am I not on a bus line?
Mm,
Do I take insurance or am I only out of pocket?
mm,
We start broaching when we look at intake forms. A lot of intake forms don't have a lot of emphasis on culture, but if we put elements of culture in the intake form, that may be a cue to the client. Oh, I can talk about this in this session. When we
Yeah.
go on Psychology Today and post information about, what are areas of expertise, that's an opportunity to broach, to say that this is a population that is important to me, or these are topics that are important. So we are communicating in what I would call meta communication even before we see a client.
Oh,
When we do informed consent with clients, there's an opportunity to broach, even before you've had a conversation. That sometimes my clients like to talk about how, they may talk about, sort of family dynamics. They may talk about work-related issues. They may talk about disability kinds of concerns, but they may also talk about other aspects of race, ethnicity, and culture. And I invite you to talk about that, when you see it as relevant. So you are poising the client to have these
yes.
conversations even, before they start formally. And
Now
then, mm, go
that's a
ahead.
whole systemic structural
Hmm.
change
Hmm. Hmm.
because if you talk about uncolonizing and decolonizing and adapting,
Hmm.
but what you're doing is you're saying um, we start this conversation like you said before we meet. The
Hmm.
conversation begins with how we introduce
Hmm.
ourselves
Hmm.
virtually, indirectly.
Hmm.
Um, that is something I know folks are not talking about enough. I
Hmm.
love that.
Hmm. Hmm.
I love that.
And
Broaching
then,
doesn't begin when you are in the room necessarily, because if they're in the room with you, they've had some introduction to you, perhaps more
hmm.
than you've had to them if they've done
Hmm.
any research.
Hmm. 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 Absolutely, absolutely.
Yeah,
And
that's
then the
powerful.
last, well, two more parts. The strategies part talks about how we actually go about broaching. So we join with the client. So how do we establish the relationship with the client, validate and affirm the client, identify client strengths? And we know with minoritized individuals, a lot of times people don't see their strengths, they see their deficits. So how do
Mhm.
we identify their sources of resilience? How do we identify their unique strengths and resources? How do we connect with the client? How do we use their language to help them feel heard and understood in meaningful ways? That
Mhm.
so
Mhm.
joining is a component. Then assessment. How do we assess, like, engage in multicultural case conceptualization? So thinking about all of the different dynamics that are going on with the client that don't sort of position us to reduce them just to race or gender, but to look at them in very complex ways. And I use the respectful model, DeAndrea and Daniel's respectful model, as a way of helping people conceptualize their client broadly.
Yeah.
And then we talk about the relationship. So before you broach, you need to think about the relationship, the counsel-client relationship. Is the client ready to have this conversation? Is the counselor ready to have this conversation? Do they have a level of self-efficacy? Are the counselor and client ready? Has the counselor assessed the client's developmental identity domain? So have you assessed their racial identity development? Have you assessed their gender identity development in ways that will allow you to think about their readiness, their preparedness to have this conversation?
Yeah.
And in it, I have a model that is drawn off Janet Helms's model, that it's a broaching interaction model that allows us to look at the where a client is and then to determine what we're going to do in terms of broaching. So for instance, if they're in a low level of racial identity development, we don't broach. We might put it out there. We might explore where the client is, but we're not forcing the client to have this conversation. We're leaving it open-ended. If
Mhm.
they are in a state where they are hyper focused around issues of race, we don't retreat. We want to find out what is the intensity about? Like what happened to you?
Mhm.
What are the dynamics and experiences that you have so we understand why a person is where they are? And then if they have a balanced sense of racial identity development, then we proceed with the, broaching dimensions. And then the third part of the strategies model is sort of thinking about what you're going to say before you say it. You don't just
Mhm.
blurt out. You organize your thoughts in a meaningful way. And then finally is the delivery. And after the delivery, we use silence. Again, that helps us organize our thoughts. It helps the client reflect. We integrate broaching with foundational counseling skills, reflection of content, feeling, meaning, interpretation.
Hmm.
questioning as appropriate, silence. And then sort of flesh out what's going on and name and label. I think a very important part of broaching is not dancing around issues, but naming and labeling dynamics that are going on with the client. Um,
Hmm.
so being explicit about the labeling. So
Yes,
yeah. Hmm.
yes. As I'm listening to everything you're saying, I'm thinking about all the ways and all the reasons why topics around race, ethnicity, and cultural identity are so hard to talk about in this culture, in this society. Our nation obviously has a long and troubled history with race relations and power dynamics and marginalization and privilege. And unfortunately, we're living in a time where these conversations are discouraged.
Hmm.
We're supposed to, but there's a school of thought that says things will be better if we just let the proverbial sleeping dogs lie.
Hmm.
Um, how do you see broaching as an antidote to avoidance in people who have not come from marginalized or otherized populations?
Hmm. So even if people haven't come from marginalized populations, they
Okay.
have had some type of encounter with difference. Maybe they're
Mhm.
too tall, or maybe they're too short, or maybe they're too big, or maybe they're not bright enough, or maybe there's some kind of difference that you have experienced that may be a springboard for understanding the marginalization of other groups. So that is one way of tackling it. Another way is really immersing yourself in the literature. As counselors, well, I think it's important for us to immerse ourselves in the literature and to understand the experiences of different groups, and those, not just the individual experiences of the client, but the cultural experiences of the client. We cannot separate our clients from their histories, from their unique histories, and their political experiences. So opportunities to explore, to immerse oneself in the culture and understanding of other groups, to read. I think traveling is an important part, learning, all of that is important in terms of helping people sort of think about, even if they haven't had encounters with marginalization, how they may, support people. Whether we're psychologists, social workers, counselors, we all have ethical guidelines that say this is important, that this is not optional. This is something that we need to do. And one of the things we know is the premature termination rates, that that could be a rationale for helping people understand the, sort of the importance of having these conversations. Another thing I talk about are microaggressions. We often think about microaggressions happening out in the world, but counseling is a microcosm of the world. And so the same kinds of microaggressions that happen out in the world happen in the counseling session. And there's some studies that talk about the fact that 50 to 80% of clients that have been surveyed have had at least one to two microaggressions inside the therapeutic dyad.
Really? Mm.
Yes, uh-huh. And the scholars who focus on this literature say that a microaggression is not just about saying something insulting. They define a microaggression also as not discussing issues related to race, ethnicity, culture. I mean, so understanding that when you
Mhm.
don't have these conversations with
Wow.
clients, particularly when they are important, we are doing harm.
Wow. Yeah. Yeah. Microaggression is in the avoidance. Wow.
Hmm. Hmm. And when clients sort of get a sense of like what our style is, where we just like we're assessing them, they're assessing us. You
Hmm.
said that a minute ago. And if they think that we're not open to these conversations, they're going to withhold this information. And there's a whole body
Exactly.
of literature around cultural concealment. When clients don't feel like their thoughts, their feelings, their experiences will be validated, they withhold that information in counseling. So basically, they're not getting their needs met.
Needs met for who they are. And
Mm-hmm.
one of the core identities for most racialized people, minoritized people, would be my race.
Mm-hmm. Mm-hmm. Mm-hmm.
How do when you speak of someone, in this country, race is your uh, lead status, primary
Mm-hmm.
status.
Mm-hmm.
It's not even your achieved your achieved status. It's the ascribed status of race that we lead with.
Mm-hmm. Mm-hmm.
And to try to engage with a person and take the colorblind approach
Mm-hmm.
is totally agree with
And
you.
we're
And
often, mhm.
yeah,
Go ahead.
yeah,
We're often
just
not defined by how we see ourselves. We're defined by how people see us.
yes.
So I may define myself in a particular way, but somebody in the outside world may see me in a very different way. In fact, there's a woman, I don't remember, she's in the Southwest, but she's a psychologist and she studies what she calls street race with Latino clients.
Hmm.
And she focuses on it not in terms of mental health, but health. And she looks at street race. And so for many Latinos, they define themselves racially as white, but people outside the Latino community may not see them as white.
Right.
And she asked them how they define themselves racially and how others define themselves racially. When Latinos were defined by others as, brown or not white, they had much more negative health consequences than those who
Mm.
defined themselves as white and who were also seen as white. And so
Mm.
that sort of speaks to the notion that people are often treated not by the assumption, not by what they say they are, but by the assumptions that people make about them.
There's me.
Hmm.
Wow. Yeah, that's powerful too. Oh my goodness. This is so rich. This is so good. I'm excited to say that you are going to be one of the keynote speakers at the upcoming Reset conference. It's the Cultural and Clinical Decision Making Reset. And that happens August 20th and 20th through the 22nd. So I'm encouraging people to register for that. And if they want to hear more from you, that is going to be a great time to sit and hear you just continue to expound upon the rich body of knowledge and research that you have. Can you tell us a little bit about why this reset conference is important to you? We're talking, our theme, I should mention, the weight of the work. Tell us how broaching fits with the weight of the work as a mental health professional
Mhm.
in today's world.
I think that today we have a level of increasing complexity around issues of race and representation. In 1903, W.E.B. Du Bois said the problem of the 20th century would be the problem of the color line. We are now in like the third decade of the 21st century,
21st.
and we've still not had a meaningful conversation around race and representation. And more than that, we have even more complexities around difference. And people don't know how to have these conversations. And they are getting more politicized. They are getting, much more negative. And it feels like there's like violence, brewing, sort of behind it. And so mental health providers need to be able to have the tools to have these conversations. So I thank you for putting together a conference like this that allows people to have conversations where they might not be able to have these conversations in more mainstream settings.
Right.
Um, yeah. So I
Yeah,
think
well, it's my pleasure. Thank you for being willing to be a part of this event. I am really excited about it. Other guests, we have some of our other friends in the field that are going to be with us. Dr. S. Kent Butler, we know him as we're very proud to acknowledge him as a past president of the American Counseling Association. David Archer, who is the author of Anti-Racist
Mhm.
Psychotherapy, another
Mhm.
book that I grabbed onto years ago when it first came out. He's going to be one of our keynote speakers as well. Dr. Portia Lockett, who focuses primarily on self care and healing of the healer. So
Mhm.
she's going to be with us, and and then yours truly, humbly in your presence.
Mhm.
But so excited about this weight of the work. I think we're all feeling it.
Mm-hmm.
And you're in the academy. So you are helping rising professionals,
Mm-hmm.
the up
Mm-hmm.
and coming, get this. But the work that I do is primarily with people who are already in the field, people who are in like my age cohort who we didn't get any, we didn't get multicultural studies the way multicultural studies are presented now. So we
Mm-hmm.
have the majority of our senior clinicians, clinical supervisors, practice owners, and team leads are in my age group, where if they've not done a good bit of self study, the kind of thing that we're talking about, these topics are just not on their radar.
Mm-hmm. Mm-hmm.
So, this is a continuing education event to talk
Mm-hmm.
about the weight of the work from two perspectives, the multicultural perspective and all the things that you're talking about, the weight, the responsibility of broaching and taking the initiative and knowing where you are in your readiness to have these conversations, and then the strategies, those kinds of things. But then also the weight that we are carrying personally
Mm-hmm.
as providers who also need healing and need support and are
Mm-hmm.
doing work, and too many of the strong providers are just burning out and losing interest,
Yeah.
and we don't need the strong people to walk away. We
Mm-hmm.
need the strong people to be trainers. We need them to be mentors and champions and voices in the community. So the weight of the work, I think, involves not just what we do with the people in our who are members of our practice communities, but what we do within the profession and how we take care of ourselves in the
Yeah.
midst of all of this.
Mm-hmm.
So that's the theme of the cultural and clinical decision making reset, the weight of the work. And your work certainly fits right in there, front and center, with this concept of broaching.
Mm-hmm.
So I thank you for your contributions to our profession, to the world, because certainly beyond just mental health providers, the work that you do is impactful in education and so many other professional disciplines.
Well, I just want to thank you very much for inviting me. This work has been a labor of love, but it really makes me feel even more special when one of our own invites, me in to be a part of this event.
Well, that was a no-brainer to invite you in to be a part of this. Um, we're going to put at the end of the podcast today the information about your book. We'll put the cover, the title, where, how to pre-ordering. You still pre-ordering?
Yes. Hmm.
Okay. How to get your pre-orders in so that you can be among the first to get this critically important um, work in your hands, and not on your bookshelf. I want it in
Right.
your hands. I want you reading it when it
Hmm.
comes.
Hmm.
And then you put it on the bookshelf as a reference after you've read it. But now I want to put all that information and how people can reach you for speaking engagements and consultations and other things. So that'll be at the end of the credits for the podcast, as will be information for how to register to hear Dr. Norma Day-Vines at the Reset Experience, August 20th through the 22nd. Thank you again so much. Any closing remarks for our audience today?
I just want to thank you for assembling mental health providers and speakers to come together and to collaborate on issues that we are sort of dealing with professionally and personally on a regular basis. I want to thank you for your leadership and all the hard work that you've done, because this is so critically important. And again, I'm honored to be a part of this event.
Thank you. As you said, it's a labor of love.
Mhm. Mhm.
Yes. And thank you all for joining in today. And I invite you to share this. Don't forget to like, subscribe, put a heart, do whatever the platform allows you to do to say, I like this. Put a comment in there. Be certain to subscribe. Dr. Norma Day-Vines, you still have your YouTube
I
channel?
do. I do still
Okay.
have my YouTube channel.
We're going to put that in the credits as well so people know how to tune in to you in the future also. So, thank you again for being a part of the audience. Remember, if you are a mental health provider, most important thing we can do is continue to practice with cultural humility, empathy, and a multicultural mindset. I'll see you next time.
Please join me at the Cultural and Clinical Decision Making Reset Conference, which will be taking place virtually August 20th through the 22nd, where the theme is the weight of the work. And this is a conference that's designed for mental health providers to come and talk and reflect on their clinical practice and what it means. I will be conducting a keynote address and featuring my new book, Broaching Race, Ethnicity, and Culture in the Counseling Process, Strategies for Facilitating Meaningful Dialogue with Clients. I'm looking forward to joining LaVerne Collins and all of her guests at this conference, and I hope to see you there too.